Okay, fine. So our today's session is about the movement approach to fascia. In previous session, we discussed about initiation, like how to see the movement. That is very essential for any prescribing exercise, as well as when you are into the zone of history part. When the patient is asked, when the is telling you whole story, what he is suffering from his complaint, or what he is suffering from the specific symptoms, then it is very important to us from the history part. We can make out whether the person has which articular problem, or the person has a myofascial problem. So in this session, I'm going to tell you about the movement approach to the fascia. We'll explain in detail about the physiology of a fascia and what are the slings that we need to see when the patient is into a certain position, or he is demonstrating any type of any exercise. So the course objective of this session is understanding the skin, fascia, and its interference with the MSK problem. We'll develop the 3D understanding as well as the trigger point and Janda syndrome. It is very common in our clinical practice that the patient is suffering with the trigger point, and he develops, or he shows a referred pain pattern. Many of times we give them a label, the radiating pain. In spite of giving a traction or any modalities, the person will not relieve from the referred pain. That is because of the trigger point problem. But identify the trigger point, that is very essential part in a assessment session. Now let's start with the fascia. It is a web-like structure, as you can see on the right side of the picture. It is a large complex organ of the body. It complex, dense, innervated with nerve fibers and send information to the brain. The fascia covers the whole body. There are different layers in the fascia: superficial, deep layer, and all this layer is interconnected with each other. We tell our patient that many of times the fascia is tight. Let stretch the fascia, but we cannot stretch the fascia at all. It will take minimum 1 to 3 years if we want to stretch the fascia, and that stretch should be sustained. The fascia is the 3D spider web of a fibrous gluey and fascia wet proteins that binds them together in their proper placement. Fascia is like a covering part over the muscles. And above fascia, there is a skin, and it's the specific layer. So for understanding the skin, we know from our college days in first year, the physiology, epidermis, dermis, as well as the different layers where the blood vessels as well as the fascia lies. The skin is very complex structure where we find out the receptor sites in the epidermis. The subcutaneous fat, which is just above the fascia, and subcutaneous fat and the muscles in between, there is a sliding component which is called a fascia. And fascia is very important structure in human body. It requires a lot of water. That is why we find out in a late stage, above 55, 60 years of age, those patients suffering with the inflexibility issue. The reason is they have a very less watery content in their body. The cells doesn't contain too much of water. They just dislodge from the cells and going out from the skin itself. And for the facial layer, it's a superficial, deep, intramuscular, and a visceral. As you can see on the right side of the picture, the skin, then there is a superficial fascia. Between the superficial fascia and the skin, part, or any case or any circumstances the patient is not moving his limb. First of all, we have to hydrate the body first, as well as start passive movement. The reason is there is lack of movement in between these two layers. When we are doing the passive movement, we are just creating a passive mobility, not we are improving the active mobility. You can also use some pressure. We cannot use the foam roller immediate after the surgery or immediate after the injury, but after a few days when you want to go for any movement part, start with the foam rolling, or you can use some manual therapy. That is also helpful. So this complex structure of the body, it is it is essential to understood about these things. So that reason we need to hydrate first before moving any body. So next time when you are treating with the immobilization of a knee joint or any joint, ask the patient to first hydrate, and then you use your techniques. The old versus new lens of anatomy. This film is very well known. It is a Terminator. Okay. So the one is Arnold and the another one is the villain. I don't know the name, but the Arnold moves like a robot. We know the anatomy, the biceps muscles, the flexor compartment. Okay. The robot moves in a 2 dimension only. So when he wants to move, he just move in a single plane. He doesn't move in a 3 dimension. If you have watched the movie very closely, when he turns on the right or left side, he turns his whole body. On the right hand side, he has a very expanding, his body is like an stretch. कुछ भी चीज के ऊपर यानी वो जाएगा तो वो पूरा का पूरा स्ट्रेच होता है. It moves like a very fluid movement. Okay. So nowadays we want to see from the different perspective, like from the fascia point of view. Fascia is also important aspect in human body. It is not all about just only looking for the tissue, as well as by doing the mobilization. The fascia is moving the muscles. If the joint is not moving efficiently, first focus on fascia. If you find out the fascia is very mobile,